for having me and for, engaging students with the Canadian Mental Health Association. So we're located downtown at 111 Elm Street. So very easy to access. We're just right beside the Clarion Hotel, and there's parking in the back of the building. But it's also easy to access via bus and transit system for students. First point of contact at CMHA is intake. So you don't need a referral to come see us. You can just kind of walk in the building or give us a call. If you're having a bad day, we provide something called brief services. So it's just kind of that, that additional support of, I'm struggling today, or I'm really overwhelmed, I'm stressed out, and I need to talk to somebody. So you don't necessarily have to commit to a case manager. They provide supportive listening as well as family support. Referrals to community services. So we have a no wrong door policy. So if we can't help you, we make sure that we're connecting you with the proper resources and community that can provide you that support. We also provide the admission and discharge criteria and assessment tool, which is the ADAT. It's now been changed to an assessment called the GAINS assessment, but it is very similar to the ADAT. So what that is it's an assessment that's completed for those who are struggling with substance use, who are looking to go to treatment. So typically any treatment center would request this ADAT to be completed. And if you are a good fit for our programs and services, we complete the intake for mental health and addiction services. So our community support services is our clinical program. So they focus on the living, working, learning, and social aspects of life. So if somebody is struggling with housing, we can support with that. If someone is struggling with employment, if someone is struggling with school, if it's the social connection piece, we can support with that as well. So it's very much the student would be in the driver's seat of, what they want to talk about and what they want to work on. So you're connected one-on-one with a social worker, and they provide you with that support. And it's very person-centered. So instead of focusing on an illness like anxiety or depression, they'll focus on the person first, which is a really great approach because oftentimes in clinical settings, you don't necessarily see that. So our health promotion program is providing that education. So we try to increase community awareness of mental health problems, of what supports are available within community. We also host various events. So we have a program called Talk Today, which is a partnership with the OHL and the NOJHL. So we team up with them and we provide safe talk training, which I'll talk about in just a moment. We also put out a newsletter on a monthly basis. So keep an eye out for that because it has programs updates as to when we have openings for things, what courses we're running, what we're up to in community. So it's good to kind of stay in the loop that way. And you can access that newsletter by just visiting our website. So it's sm.cmha.ca. We also have social media accounts. So we're on Facebook and Twitter. So if you want to give us a follow, we have some updates there that we provide. So these are the trainings that we offer through CMHA in community. So ASSIST is a 2-day training that we've delivered on campus before with in partnership with the university. So it's short for Applied Suicide Intervention Skills Training. So it's a 2-day course and it focuses on suicide interventions. Safe Talk training is a 3-hour training that focuses on suicide alertness. So how to recognize signs and symptoms and how to connect them to the proper supports. And Suicide Talk is just a general brief overview of different stigmas and myths around suicide. So it's just really opening up the conversation. Mental Health Works focuses on mental health in the workplace. So it addresses issues on a supervisory level as well as the employee level, how to have conversations around mental health, different accommodations that are available. Mental Health First Aid is a 2-day course. We focus on, different mental health problems and how you can support someone who's in crisis. Living Life to the Full is an 8-week course. It's very positive. It's cognitive behavioral therapy based. So we focus a lot on delving into, different unhelpful thinking styles, unhelpful behaviors, and things that we can do now to make ourselves happier and to make a difference. And we partner with CMHA as well. So they offer a series of webinars on older adults, COVID education as well. So they're a really great resource to have on hand. So we have some community resources that I'm going to talk about in a little bit more detail. But first I want to talk about Bounce Back. So Bounce Back is a program for adults 19 and older, but it also has a section for youth between the ages of 15 and 18. So what it is, it's free online and telephone coaching. You need a referral from a healthcare provider, but your healthcare provider could be, just someone at a walk-in clinic, getting them to complete your referral form. It's geared towards those who are experiencing mild to moderate depression or anxiety. They mail you booklets. You work through these booklets with your coaches on the phone. It's available in several different languages. So it's very accessible to students. So it's a wonderful resource to have. And why it's so great is that everything is kind of done remotely. So you don't have to worry about even leaving, let's say, your dorm room if that's where you are. Together All is another great resource. This used to be called the Big White Wall. So it's an online community and it provides confidential support for mental health. So there's a lot of different webinars that you can register for. There's an online platform where you can search by topic. So if you're dealing with stress around exams, you can type that in and a lot of resources will come up for you to rely on. So NISA is the Northern Initiative for Social Action. They're located on Elgin Street. They provide in-person peer support. So that kind of one-on-one support from someone who can relate to what you're experiencing. So NISA focuses a lot on the development of occupational skills. So they have lots of different programs like Food is Mood, where you're learning to cook on a healthy diet and budget. As well as quilting programs, there's writing circles, there's all kinds of different supports. They have the Alternatives to Suicide group, which is for those, it's a safe space to go and just talk about, ideations around suicide. The Regional Warm Line is available to students 6 p.m. to midnight. And this is a warm line of, I'm starting to get a little bit overwhelmed. I need to talk to somebody. You haven't quite reached that point of crisis yet. Then we look at HSN Crisis Intervention Services. So they're available 24/7 by phone. So this is if someone is struggling with thoughts of suicide or is in, a really big crisis. They have in-person supports at 127 Cedar Street, right across the street from the bus station. And they're available 8:30 to 4:30 Monday to Friday. They also have mobile crisis services where they can come to you. So they're available between 10 a.m. and 10 p.m. So lots of supports out there in community, and there's no need to feel like nobody's out there to help you. So that kind of takes me to the end. We do have a lot more programs and services at CMHA, like our justice program. We run the off the street emergency shelter, the harm reduction program. But what I've gone over is just basically what's the most relevant and available to students as far as supports.